Good afternoon. Today, I'd like to begin with some of the latest news, not out of Washington, D.C., but out of Stockholm. The 2020 Nobel Prizes have once again recognized some extraordinary Californians. After all, we have more startups, more engineers, more scientists, more researchers, more venture capital, and more Nobel laureates in California than any other where in the nation. And that trend, not surprisingly, continues again this year. Just this morning, two Stanford professors, Dr. Paul Milgram and Dr. Robert Wilson, were awarded the Nobel Memorial Prize for Economic Sciences. Their pioneering research in auctions has had practical impacts on the best way to allocate scarce resources. They joined several other Nobel Prize winners from our state who recently were announced, products of UC system. Here are, by the way, some fun selfies of those Californians the moment that they received the news. Dr. Andrea Ghez of UCLA won the Nobel Prize for Physics by providing, or rather proving, the existence of a supermassive black hole at the center of the Milky Way. And she shared this prize with Dr. Reinhard Genzel, a professor emeritus at UC Berkeley, who also did his postdoctorate work there. And Dr. Charles M. Rice, an alum of UC Davis and Caltech, won the Nobel Prize in Medicine for discovering the hepatitis C virus. And that discovery has made possible blood tests and new treatments that have saved countless lives. And finally, Dr. Jennifer Doudna, who was honored for her discovery of the CRISPR gene, the editing tool, which has revolutionized life sciences and applications across science, medicine, and agriculture. Most recently, it's been applied to COVID-19 diagnostics. It may, in fact, be the key to scaling low-cost, high-accuracy testing. It's also using CRISPR technology to, well, start to develop testing and, perhaps more importantly, treatment for COVID. And for Dr. Doudna, the Nobel came with something perhaps more valuable than the $1 million prize. It came with a free parking spot for life on the UC Berkeley campus. Congratulations to her and all of the outstanding Californians we honor here today. Look, battling COVID-19, it requires close collaboration between the state and local government. And throughout our fight against COVID-19, the state has worked closely with local governments to slow the spread, fill the gaps, and let locals lead in their communities. Together, we've made important progress in helping to stop the spread of the virus by building a contact tracing army and expanding and speeding up testing. Today, I wanted to update you on some of those efforts. Notably, the efforts to increase testing, which now are averaging over 125,000 daily tests. Over this weekend, we were averaging a little north of 150,000 tests, 169,000 on Saturday, about 144,000 tests just yesterday. We're getting those test results back within 24 to 48 hours. In fact, 90+% of all the tests that are being conducted are getting back within that time frame. And as a consequence of that timeliness to test results, it enables our local contact tracers to get to work immediately. I wanted to update you on the total number of trained staff, the total number of contact tracers now that we have assembled here in the state of California, just shy of 11,000 now trained staff, 10,892, 1,800 plus bilingual staff. And I'm going to ask Dr. Galley to come up here in just a second and talk about some of the remote support that is also part of our contact tracing efforts. A lot of work has been put into this place. Not much attention, perhaps, is deserved. And that's why we wanted to highlight some of our contact tracing status here today. And again, no one better to do that than Dr. Galley.
Thank you, Governor. And yes, it's good to be with you to talk about our developments on contact tracing and really where the governor started that testing piece that starts us with case identification, finding out who's positive, and then we go into the disease investigation part of the endeavor and identifying close contacts of people who are positive so we can then provide the support and reminders to isolate appropriately so we can actually cut down transmission from each case. That isn't a new set of strategies for COVID. We've been doing this in public health for decades to control other diseases across the globe. And here the challenge is just doing it at the scale where we have thousands of positive test results coming a day to make sure those thousands stay as low as possible. I talked to you many weeks ago about the need to get our case rate down and our infrastructure of contact tracing and disease investigation up. We've done that with these 10,000 plus trained staff, many bilingual staff, not just in Spanish, but in Cantonese and Mandarin, Hmong language, many different languages across the state. And then the ability to use something we've all become familiar with in COVID, which is remote interactions. Many of you do Zoom meetings or Zoom encounters and meet friends remotely now via your iPhone and other phones. We also have employed those same technologies, providing disease investigation support with epidemiologists that might be in one county supporting another county hundreds of miles away because they can do that remotely. Also adding a virtual agent function to our CalConnect. That's the program that the governor really pushed us to create statewide to organize all of the case information and the contact tracing work. Now there is a function that allows us to do an initial survey of individuals who tested positive or who may have been exposed so that health departments can begin to prioritize those with the most concerning exposures. So all of that together with the staff are really building up this infrastructure across the state so we can continue to box in the virus as much as we can and make sure that a single case doesn't turn into 20 or 30 cases from that single one. So we did this twice. We did a survey many months ago of our local health jurisdictions to find out how successful their existing infrastructure was to contact trace all the cases that were discovered as well as their contacts. Back then, we were certainly lower than we are now. And today, we are finding that 95% of our local health departments are able to contact all of the new cases that they receive results for on that same day. So the addition of quick testing with quick turnaround time, that 24 to 48 hours, plus information in the hands of local health jurisdictions and the staffing sufficient to reach all of those positives gives us a better chance of making sure somebody who is positive doesn't transmit to others. Similarly, we have 97% of our local health departments who are able to contact all of the contacts that we learn about on that same day. These two things together allow us to have a better chance of keeping COVID in check. Part of this really does start with the support of the state with our local partners. I want to remind you that contact tracing and disease investigation is a tried and true public health tool. The local health jurisdictions across the state have been doing this for a long time. They've beefed up their staff, increased their staff and their tools along with the state's support to do this. We are now turning a significant part of our focus at helping our local partners with school-based modules in CalConnect, making sure that we're able to track cases in schools either among staff or among students, and providing tools to increase our ability to address outbreaks and investigate them quickly. I want to remind you that we did pursue a public-private partnership with Kaiser, many other philanthropic partners, to work with our local entities to deploy local teams, people in community-based organizations that really do know the communities well, that live and work within the communities to provide a closer touch to those who might need that contact tracing and isolation support. And we also put out and described, when we described our equity metric, the need for counties to use state funds that were provided to the counties to do testing, contact tracing, and isolation, to make sure those dollars are invested in those communities where we've seen a disproportionate impact on COVID. Those dollars are there in part to support the last piece of this three-legged stool, that part that focuses on isolation and supporting individuals who learn that they're positive or may have been exposed to either quarantine or isolate, whichever is appropriate, and to make sure that they do it in a supported way. We know so many people fear not being able to return to work, not being able to support their families. There are many tools that the state, along with our local partners, along with our philanthropic partners, have put into place in order to support those isolations to not just happen, but to happen in the most complete way so we box in the virus and reduce transmission. So with that, I want to turn it back over to the governor. Thank you.
Thank you, Dr. Galley. And so the key is the issue of isolating individuals that have come into contact or have the transmission of the disease made positive, meaning we want to make sure that the testing leads to something. And in order to box this virus, in order to mitigate the spread of this virus, quarantine and isolation become essential. And I just want to remind people some of the work that's been done in the state of California, resources that we've made available to help support isolation. One of them, Dr. Galley alluded to, is these job protected paid sick leave that we've now provided to California's workers, which is foundational in the endeavor of isolating and quarantine individuals. We've also targeted very specifically our farm workers and our agricultural workers all up and down the state of California, a program called Housing for Harvest. We had highlighted it on multiple occasions in the past in these updates, a program that now is operational, and we hope to do more and better still to expand the scale and scope of that effort. Project Room Key, which we've highlighted on a consistent basis, is foundational in terms of isolating individuals that are high risk of COVID-19, particularly those out on the streets and sidewalks, in congregate facilities and shelters all throughout the state of California. And of course, the federal government, no substitute for the support we get from the federal government. $150 million of federal support is provided, not just to the state, but also supporting those county efforts. In addition to those county efforts and federal dollars, it's that leverage of philanthropic support. Reference a moment ago what Kaiser has provided, other philanthropic supports, but some $83 million in philanthropic funds have been generated and recognizably, deservingly need to be highlighted in the effort to, again, support our isolations and quarantine efforts. So that's just a brief update on some of the contact tracing work, some of the isolation, quarantine work, the testing we continue to make progress. We will very shortly, in the next couple of weeks, we will be announcing an update on our partnership with PerkinElmer and the efforts to more than double the capacity of testing here in the state of California. Real progress is being made in that space, and we look forward to making that announcement very, very shortly. We are not going to slip backwards on testing. We are going to forge forward and be much more aggressive. We're not ashamed of testing people. We're not ashamed of identifying individuals that have been tested positive. But we must make that meaningful. Testing for testing's sake is not in and of itself significant, save the patient that can learn about their own health and health risk. From a community spread and a transmission perspective, we need to make sure we go further than that. And that's the contact tracing, that's the education, Know Your Rights campaign, among many other efforts that we've advanced through PSAs that will allow people to support so they can isolate, they can quarantine, not only taking care of themselves, but their own recovery, but mitigating the spread to people they love, and more broadly, the community spread. And so all of those efforts are being accelerated. All those efforts are being reinforced, and news on the very exciting and significant increase in lower cost, much more timely testing that we have advanced in this historic partnership here in the state of California. Let's talk about our case rates here in the state. The new number we announced today, 3,449 cases. This is from October 11th, yesterday. Tracks slightly higher than our 7-day average of 3,000 321 cases. You can see the positivity rate based on the 127,000 average daily tests over the last 7 days. It's dropped to 2.6%. That's a 14-day positivity rate. The 7-day positivity rate is consistent with the 14-day positivity rate, 2.6% here in our state. Hospitalizations have decreased 8% over a 2-week period, and we're seeing a decrease in ICU admissions, a little bit more substantial, 13% over 14 days. You may recall, we're seeing a bit of a plateauing, or at least a slowdown in the rate of decrease. You've seen 20+% rates of decrease in hospitalizations and ICUs over the course of many weeks, slowing down modestly. Again, these are just areas of caution, sober reminder of how stubborn this disease is and how prevalent and widespread this disease still remains here in the state of California. Always a reminder of the imperative and importance we place upon practicing the physical distancing, social distancing, and the critical work that you can do by wearing these face masks. Accordingly, we have made progress on our tiered status. Now 42 counties of the 58 have moved out of that lower tier, the most restrictive tier, the purple tier. 24 counties you see in the red, 11 in orange, yellow counties in the northern part of the state, primarily, though some in the central part of the state represent 7 of our 58 counties. This county update, the tiered status update, is made every Tuesday. Tomorrow, Dr. Galley will be updating these numbers. Progress, I want always to lean in, but they're always adjusting those numbers from the weekend, and so I have to be careful. But we will make progress. A number of counties now moving into new tiers, but again, stubborn. This virus, some counties teetering. And so that will be made public tomorrow. Some of the latest information, again, being put together later this afternoon, updated every Tuesday at Dr. Galley's presentation. But county tiered status, nonetheless, moving in the right direction broadly for the overwhelming majority, now 42 counties out of that purple status into these other tiered status. Speaking of status, I wanted to update you briefly on the wildfire season, which continues. This is around the peak of what we have experienced the last few years, at least, of the wildfire season. Into October, the Diablo winds and Santa Ana winds start to present themselves. Still hot temperatures, unseasonably hot. We're going to expect up to 20-degree increases in temperatures from what we experienced over the end of last week and over the weekend into this week. We're also going to see an increase in winds later this week. Wednesday, Thursday, and Friday in Northern California in particular, we're expecting high wind events, 45-mile-an-hour gusts, based upon the analysis and the briefings that we got this morning, as high as 60-mile-an-hour wind gusts in Northern California. So PG&E territory working on their protocols around PSPS, partnerships with the cities and counties, and with Cal OES and Cal Fire being advanced in those areas. Notification protocols that have improved from last year now in place, and again, strengthening partnerships that included $50+ million of support money that we distributed to the counties and to NGOs, non-governmental organizations, nonprofits, as well as state agencies to help support on notification and support vulnerable communities as it relates to those that may be impacted by PS protocols. I want to just update you about the impact of these larger wildfires and remind you in the aggregate, some 4.1 million acres now burned in the state of California. We're currently dealing with 14 major fires and/or wildfire complexes. Some 12,000 firefighters. You saw those numbers north of 18,000 a few weeks back. Now about 12,000 plus firefighters working to battle these historic fires here in the state. Tragically, we've lost 31 lives. That number has remained relatively stable, and I caution always the fatalities and structure data likely to increase as we repopulate areas. Some parts of Trinity County, they have been evacuated for close to 30 days, some cases north of 30 days, as we go back in and we do justice to this, well, do justice to the repopulation and reconnection to friends, families, and communities, we're likely to see higher structures damaged and destroyed, and obviously concerned always about lives lost. The glass fire we talked a lot about last week around Napa Lake and Sonoma counties. Last week, 30% contained, stubborn fire up in the wine country, some 65,000 acres impacted. Today, it's at 95% contained. Real progress over the last week and notably over the last weekend, and couldn't come too soon, particularly with the higher winds in and around that area coming into that part of the state, again, Wednesday, Thursday, and Friday. Additionally, real progress, in fact, not just real progress, substantial progress on the Zog fire, now 99% contained. I'm told within a few hours later this afternoon, they will officially put out 100% containment figure on the Zog fire. Two large complexes, just want to give you a brief progress report on two of the larger active wildfires in the state. Again, the largest in California's history. The August fire, over 1 million acres, 54% contained last week. Now it's 75% containment. It's the northern part of the August complex. U.S. Forest Service battling hard. That's the most stubborn. And while there is some concern around wind conditions that could impact the northern part as it relates to containment, we've been anticipating that. The Weather Service, again, working collaboratively with the state, pre-positioning assets and really building the conditions to hold the line in the northern part so we can hold this 1+ million acre fire in not only containment, but hold the line so we don't see substantial increase in the total amount of acreage burned. Rates to creek fire. This creek fire generated a lot of attention for good reason. I'll remind you, this is in and around the area that was disproportionately impacted by this historic drought here in the state of California. You recall a drought between 2011 and 2017, about 163 million. And by the way, that's just an estimate, 163 million trees that fell because of the drought, historic, unprecedented, recently historic and unprecedented conditions that led to conditions that make it even more challenging in and around Fresno and Madera area. And this unified command complex, again, working with the federal government, a lot of federal acreage being burned here, as well as state acres being burned here, 48% contained last week. You can see the acreage burned in this last week has not been substantially greater, meaning we've slowed the rate of spread, 322,000 acres to 333,000 acres, but it's still a stubborn complex, 55% containment, a little better than last week's number at 48%. So as always, we want to maintain our vigilance as it relates to heeding the warnings of those that call for evacuations related to these wildfires. I want to remind people of the importance and imperative of being even more vigilant in these dry and hot conditions where we start to see these winds whip back up. It was this time in October and November in 17 and 19 that we had some of these very damaging and deadly wildfires. Please maintain your vigilance. Please take very seriously those evacuation warnings if indeed you are the recipient of one of them. Critical that we protect ourselves and our family, our loved ones during this peak of our wildfire season. But progress across the board has been made, testament to the extraordinary work the men and women of CAL FIRE and all the mutual aid that's come in over across the rest of the country. And again, cannot thank them enough. All the hard work that's been done, including local mutual aid that has been working overtime, weeks and weeks and weeks, little rest, putting their lives on the line to protect not only lives themselves, but property and obviously our wild lands in this state. Accordingly, in closing, I just want to remind all of you the imperative of continuing to maintain your vigilance in terms of the actions you can take to spread and mitigate, not wildfires in this case, but of COVID-19. That 2.6% positivity rate is encouraging. Number of deaths has beginning to decline, which is also encouraging. Still, though, stubbornly at about 60 and 69 deaths. That's the 7 and 14-day average total number of deaths. It's just a reminder, sober reminder, the average of 69 deaths a day still because of COVID-19. Don't be misled that this disease is any less deadly. Quite the contrary. It's as much more deadly than it's ever been in the context of those that are high risk. And despite so much of the improvements we've seen in therapeutics and how we've managed the disease, again, people are still losing their lives. What you can do, as always, is practice that physical distancing, that social distancing, wear those masks, wash your hands. It's flu season. Wash your hands just on the natural will mitigate the spread of the flu as well and minimize mixing to the extent possible. Tomorrow, just briefly, and I'll turn it over to questions, Dr. Galley will be updating people on a different type of mask wearing, and that's the Halloween guidelines that we'll be putting out tomorrow. Dr. Galley will also be updating on some other guidelines, including the guidelines we put out on Friday related to minimizing mixing and cohorting friends, family, or outside of your household. Those updates have been made this week. Just to preview, we'll be visiting with some of the larger theme parks, continuing those conversations back and forth. We continue in good faith to try to work to get where I know everybody wants to go, and that's to get people back to work and also create more entertainment options. But we need to do so in a safe way. We need to do so with a health first frame. And we are going to continue that hard work, and a lot of that work will be advanced even further later this week with some insight visits and some deeper collaboration, even beyond some of the larger theme parks, but many of the smaller theme parks that want to maintain some distinction from those larger well-known brands here in the state. So that's it for the update today. And of course, now happy to answer any questions.
Patrick Healy, NBC4.
Hi, thank you very much.
Patrick, an outstanding question. Perhaps we'll get you back on and figure out what the technical difficulty. There you are.
I'm here now. I'm sorry. Wanted to ask you a couple of things, if I may. Number one, we understand from plaintiffs in some litigation that want to try to get some tattoo studios reopened in purple tier counties, that they have been informed that they're going to issue guidelines that will enable the purple tier studios to reopen.
Yeah, Patrick, and forgive me, we'll see if we can pull you back, but I want to just bring up Dr. Galley. I believe you referenced something about tattoo parlors and guidance, and so forgive me, you were breaking up, but Dr. Galley was getting out of his seat, so that may be encouraging, that he may know a little bit more. Perhaps he may have heard you a little better than I did. Dr. Galley?
Thanks, Governor, and thanks for the question. I think the question was about tattoo parlors and whether we are considering, like we have with nail salons and barber shops, moving tattoo parlors into the purple tier. We are considering that. We're working closely with the industry and determining if that is appropriate, and hope to make an announcement on that very, very soon.
Thank you. Thank you, Dr. Galley. Next question.
Tom Thompson, AP.
Good afternoon, Governor. The Public Health Department on Friday released new guidelines for up to 3 households to gather outdoors. But we're wondering why now? What changed to permit this new guidance, which comes as we enter the flu season? And as you and Dr. Galley have been warning about concerning signs of coronavirus case increases in many areas.
Yeah, I think in some respects you answered the question, but since Dr. Galley's right here, he can talk a little bit about this in more detail. And again, still he'll do the same tomorrow in his update. But Dr. Galley?
Yes, thanks again for the question. As we approach so many traditional days and activities, and we expect people asking the question, how do we, in a lower risk way, come together with people maybe that we haven't seen in a long time. And the purpose of the small gatherings guidance that is now posted on the California Department of Public Health website is really to not say it's a good idea or appropriate to gather with 3 families, but to really say more than 3 households, you really are increasing your risk. And so we tried to put together a set of guidance that allows people to have what we in public health talk about, a harm reduction framework, really reducing risk and minimizing the chance of the spread of the disease. So we did put that out as a way to tee up future guidance around how to minimize our risk in some activities we know many Californians are considering, the first of which is coming up with Halloween. Then we have things with Election Day and the traditions of coming together around that. And then Thanksgiving, and then the other traditional winter holidays. So all of that is coming out now to support our endeavors and to support local partners, local health jurisdictions, putting out similar guidance for those events.
So you'll be getting more and more, or should anticipate more and more updates to existing guidance as well as new guidance. And I just want to remind people, and this may also be a subtext of a way of answering your question, guidance doesn't mean go. In the past, we have seen when we put out guidance and we make it clear that the pace and the protocols related to seeing that guidance applied, that does not mean people should just now rush back to their original form as it relates to kinds of activities we've seen in the past, even modified activities. We want to caution against that. But we are entering in to the holidays, but also we're entering into part of the year where things cool down and people are more likely to congregate back indoors and in settings that put put their physical proximity and likelihood of transmitting disease at higher risk. And that's why you'll again be seeing more in this space over the coming days and weeks.
It's Michelson, Fox 11.
Thank you, Governor. 2 quick questions. One, is there a safe way to do any sort of Lakers championship parade? And thank you for giving us a shout out last night on Twitter. And 2, you know, this isn't all happening in a vacuum. And I'm wondering what you're learning from other states. Say Disney World is open. Are they having a big outbreak in Florida? What does that teach us about what's happening potentially here in California? Other states are more liberal when it comes to opening gyms or indoor dining or other things. What are we learning from what other states are doing?
No, it's a good question. And I have a whole team that spends their time not only getting the answer to that question, but asking those same questions. And so this week, as a proof point of that, we have supported an effort to actually find out directly by sending our own team to these sites as it relates to theme parks to get a better sense of what's going on. While we absolutely take people's word for information that they provide us, we want to see things for ourselves. And so that's just one example of some of the work that we do. We share information 24/7 back and forth, not only between counties and county health officers, but respective team members, particularly in this West Coast collaborative that include our chiefs of staff, are constantly sharing information about what's worked in their states and what hasn't worked in their states as it relates to guidance, as it relates to mandates, as it relates to messaging. So that is also a very formal construct that we created, again, part of that Western Coast collaborative that we announced a number of months ago. So we're constantly iterating. We're looking for best practices, not only across the United States, but around the rest of the world. But we are California, and we have values, and we have an approach, and we have a new frame of discipline, and we're going to be stubborn in terms of keeping people's health front and center and balancing all of these commensurate challenges as it relates to getting people back to work and addressing people's isolation and stress and anxiety and getting our kids back in in-person learning, and the incredible importance that we place on all of that at the same time. And so hope that gives you a sense of the work that is currently being conducted. As it relates to the Lakers, yes, I am a Northern California resident, but I am a Laker fan. I can say that without fear of any ambiguity. And if you saw our household last night, my wife, I don't think she'll speak for another 3 or 4 or 5 days. She lost her voice in enthusiasm after that first quarter. And then things calmed down for her in that second half as it appeared that the outcome was now determined. But anyway, I get off base. You asked a more substantive question, and that is there a safe way to have a parade of sorts or celebrate a victory? There is if people are practicing what we're preaching as it relates to wearing a face mask and doing what they can to physically distance and to minimize the mixing outside of their key cohorts. If that's not the case, and we saw some images last night, that is a point of obvious concern as it relates to the transmission of the virus. And so we just ask people to be cautious, to be mindful at the same time they celebrate this historic victory and celebrate one of the greatest basketball players that has ever lived, LeBron James.
Sophia Balog, Sacramento Bee.
Hi, Governor. Over the summer, you had asked state agencies and departments to make 5% of their staff available to help with contact tracing. Can you give us an updated number in terms of the percentage of state workers who are still helping with contact tracing efforts?
Yeah, I'll have to do the analysis and I'll provide that data across the spectrum of hundreds of thousands of employees. But look at your inbox and we should have that information to you hopefully later this afternoon. I can't imagine that information will take more time than that.
Brady McDonald, OC Register. Final question.
Hey, Governor, I had a couple questions about theme parks. Do you envision separating smaller theme parks from larger theme parks in the upcoming guidance? And second, what will your administration be looking at during their trip to examine the reopening of Disney World and other Florida theme parks?
Their own experience, their own insight. We're trying to get a better handle on what we're being told, what we're reading about, and our own concerns and our own environment as it relates to what makes our theme parks distinctive and unique. And one of the things that's self-evident that makes them distinct and unique is location in and around areas where there's background transmission rates that are remaining very relatively stable in some cases, stubborn in other cases. But the answer to your previous question is yes, I'm very mindful. For example, if you have in a park in a city a Ferris wheel, that's not a theme park in the sense that so many of us consider. And so one has to distinguish between the two. And so that's a nuance here. This is as almost you're putting an entire new set of guidelines and starting from scratch across the board. There's conference facilities, there's parades in these theme parks, there's cities, there's small cities, and there are people from all around the world that descend, not just people that are proximate to these theme parks that come together and mix. You could say 5% at a theme park, that's thousands and thousands of people. A large theme park, if you say that it's something on a pier in a smaller community, it's a few hundred. And so all of this has to be considered. All of that is distinctive and all of that requires nuance. And so we're going back and forth. We've had guidelines, we put out drafts, we got a lot of feedback on those draft guidelines. Folks asked us for more time. They asked us for more deliberation, engagement. We're doing just that. We're seeking to understand ourselves directly without the intermediaries. And that was the frame that I was focusing on a moment ago, that we're doing our own stubborn research and going across states to learn more and not just making this an academic exercise. I want folks to come back and tell me what they saw, what their own experience was, because this is serious. At the end of the day, we may be a 2.6% positivity rate, but we're entering into not just the flu season, we're entering into a period of time where people are more likely to start congregating and mixing back indoors as more and more indoor activity takes shape. I am very mindful of the economy, mindful of the importance and imperative we as parents place on getting our kids back in school. I want to see more businesses reopen, and I want to see more kids back in school, but safely. And the way to avoid a setback is creating conditions where we're encouraging a massive amount of mixing and encouraging a condition and environment where you're more likely, not less likely, to come into contact with someone who may have been exposed to this virus or maybe asymptomatic and is positive with this virus. And so I am very, very sober about the responsibility and the expectation that is placed upon this administration and administrations across this state to keep people safe, at the same time balance the economic imperative of reopening with modifications, but mindful of trend lines you're seeing across the country, for that matter around the world, from Germany to UK to other parts of the globe that have had setbacks as they enter into the winter months. And I want to make sure we get this right. And so forgive the long-windedness of the answer. I just want you to know that we are very mindful of many of these nuances, and we want to be responsive at the same time to the concerns that many have raised based upon the draft guidelines that we did provide people last week. So with that, I just want to remind all of you to maintain your vigilance, continue to be mindful of others as you mix and as you go about your day-to-day routines. Let me thank again the men and women at CAL FIRE and all our mutual aid for extraordinary job they've done battling this historic wildfires, the folks at the Office of Emergency Services for helping coordinate all of that, local law enforcement, county health officers for extraordinary work they've done to maintain the vigilance and mitigate the spread and transmission of this virus, continuing to stay this course. If we can just continue to hold the line, we're going to get our businesses back open sooner, and we're going to get our kids back in school even quicker. So with that, thank you all very, very much. Look forward to Dr. Galley. I hope you look forward to Dr. Galley's update tomorrow on the new tiered progress. And we look forward to updating you later this week on a myriad of other issues, including, as always, an update on transmission rates and positivity rates, COVID-19. Take care.